everyone. We want to thank Ocean County Library for inviting us here today so we can share some really great information about Children's Specialized Hospital and our autism spectrum disorder, our services, our program, and all the work that we do for outreach in our community. My name is Adrienne Robertiello, and I'm the Special Health Care Educator here at Children's Specialized Hospital.
And I'm Jill Harris. I coordinate the autism program, and I'm also Associate Vice President for the Research Center at Children's Specialized Hospital. So first we want to just tell you a little bit about Children's Specialized Hospital. We're a Robert Wood Johnson-Barnabas Health Facility, and Children's Specialized Hospital is the nation's leading provider of inpatient and outpatient care for children from birth to 21 years of age facing special health challenges. Currently, we have 14 different locations throughout New Jersey, and we partner with families to make sure that our programs are family-centered and that each person can reach his or her full potential. I also want to point out that we're really excited because Children's Specialized Hospital is always growing, and so we will be expanding to additional sites in the future. The autism program at Children's is really varied. We're the largest provider in the region of services for kids with autism, and last year, for example, we saw over 9,000 children and teens with autism for a variety of services. So at Children's, we provide comprehensive evaluations for people who are seeking a diagnosis. We provide varied treatment, community education, and we're really proud to be doing meaningful, cutting-edge research that impacts the quality of life. Some of our pediatric services include services to establish or confirm a diagnosis, and those might be provided by our experts in developmental pediatrics or psychology, behavioral health evaluations and therapy, speech-language evaluation and therapy, audiology services, occupational therapy services, physical therapy services. We also have primary care currently at 2 of our sites, and this is really important because people with autism or other special health needs can receive their primary care by experts, and also their siblings who are non-autistic can also get primary care together, so that it reduces fragmentation where one member of the family sees one person for their primary care, another member of the family sees another. And again, because our experts are really so familiar and knowledgeable in the various needs that people with autism have, we find that it really provides a quality medical home approach. Other services at Children's Specialized include physiatry, which refers to physical medicine and rehabilitation. And we have many specialized services for children and teens with feeding issues. I just want to point out that feeding problems are very common among the autism population. We have a new program that's an intensive day program for people with severely challenging behaviors, as well as those with severe feeding issues that we're really excited to tell you more about. Recently, Children's, in collaboration with Rutgers and the Rutgers University Center for Autism Research, Education and Services, also known as RWCares, partnered to create 2 programs that are really bringing an important service to New Jersey and beyond. These services are located in Somerset, New Jersey, and they are focusing on people with autism and other developmental disabilities who might have severe behavior problems, as well as for the population of people with intensive feeding intensive feeding issues. This is important because really up till now, some of the families that were experiencing these issues with severe behaviors really had to go out of state, which was very disruptive, obviously, for the family, and could also be, really present a lot of barriers in terms of cost, wait time, transportation. And so while Children's has long had a very high quality feeding program that we're really proud of, we did notice that in terms of feeding, that were some children that really needed something more intensive than what we had been providing historically. So by having these intensive programs that are day programs, we've really been able to expand the services and expand the kids and teens that we've been able to help. Just want to point out here that when there's a child with autism in the family, their siblings are at increased risk for also having autism or related issues. Now again, the vast majority of siblings will not be diagnosed with autism, but there is some increased risk. And because of this, we really encourage families, when they have more than one child in the family and there's been a diagnosis of autism, to have the siblings also screen for autism. And this is something that the families can talk to with their pediatric provider to make sure that they do get some screening, so that if the sibling is also suspected of having autism or a related issue, that he or she can get services as early as possible. We're super excited because Children's is very involved in various recreation activities, and it's so important for good health and for building leisure skills, for stress relief, for so many different in so many different areas, for people to have meaningful recreation, sports, social activities that they enjoy and that they're involved in. So just a sample of some of the sports, recreation, and social programs sponsored by Children Specialized include adaptive aquatics. And I also want to point out that, again, we really focus a lot on aquatics because autistic people might have an increased risk of being attracted to water. There have unfortunately been many instances of drowning, and so really water safety is an important area for any family who lives with autism to focus on. Other areas that we have are martial arts. There's a program called Friday Night Fever that's a super fun program for teens with disabilities. It's a social and rec program. Camps, there's so much more. So I really encourage you to check out our activity connection for more information. We also really focus on how we can best partner with and support families who have children newly diagnosed with autism. So for several years now, we've been offering free workshops for parents and caregivers to focus on what are the next steps. And prior to the pandemic, we were doing this in person. Since the pandemic, we've been able to offer this virtually, which really has also expanded access for families. And so we provide this on a regular basis. It's really important to note that these workshops are provided not just in English, but also for families where Spanish is the primary language. People don't need to be patients of Children's Specialized Hospital, and these workshops are free. So please reach out to Sandra Johnson, who's our social worker, for the latest schedule. We also provide free support groups, again geared for parents or caregivers of children newly diagnosed with autism, and these support groups are conducted both in English as well as in Spanish. It's really important to also focus not just on what can best be done to support young children and school-age children with autism, but also what happens as people transition to adulthood. A lot of times we hear the expression that you feel like you're falling off of a cliff because services are so very different, and unfortunately sometimes much less and harder to access once somebody turns 21. So we're really trying to provide the Children's Specialized Hospital an increased focus on what can be done to help with this transition to adulthood. And we have various resources available for our patients and families, not just our patients and families, but also focusing on various aspects of transition, whether it's transition to adult health care, whether it's transition to other types of education, employment, housing, and so forth. Research is important for everyone, and really research is what helps to guide our services and make sure that the services that we provide are really representing best practice. It's really important to help families engage in research so that we're sure that research is really focusing on what really is driving families, is going to be compelling for families, what's going to help their quality of life, and that we partner with autistic people and their families at all stages of research. Um, a lot of the research that Children's Specialized Hospital has done in recent years has been especially focusing on identification of young children who are at developmental risk, especially those from what's considered under-resourced populations, such as families who are not white, families who are Hispanic, families where English is not the primary language spoken in the home, families that might have low income. Some of our current studies include SPARK, which is an exciting study that is actually the largest autism research study in the country. And this is funded by the Simons Foundation. We're one of several clinical sites throughout the country. It's for people with autism of any age and their families. And it's a great opportunity. It could all be done from the comfort of someone's home. You can get a gift card for participation, and please reach out to us if you're interested in learning more about SPARK. We also partner with research institutions that are really well known throughout the country and are cutting edge, such as Rutgers and the Kessler Foundation, to focus on various aspects of autism. One of the programs that we've been conducting for many, many years that we're so excited about is providing free community-based developmental screening. It's really important that if a child is starting to show developmental concerns, that this is identified as early as possible so that we really can help the families link to services and supports to help that child and to help support that family, again, as early as possible. I mentioned before that Children's Specialized has been involved in research focusing on improving early access to care and reducing barriers to care. And a few of the barriers that are well known is insurance issues, transportation issues, and so forth. So several years ago we created this program where it's free. Currently this program is offered virtually, so again people can do it from the comfort of their own homes. It's in English and in Spanish, and we partner with the families to do a brief screening, looking at various aspects of child development, and then really helping to link the families to what are the next steps. We're very happy and proud to be partnered with our friends at Rutgers. Rutgers is a site for the New Jersey LEND program, and LEND stands for LEND stands for Leadership Education in Neurodevelopmental and Related Disabilities. This is operated through the Boggs Center, which is part of the Rutgers Robert Wood Johnson Medical School. And this gives us the opportunity to work with people who are in training to be the next generation of experts and providers of services for people with autism and other related disabilities. So LEND Fellows represent families, they represent nurses, social work, people going into social work, going into psychology, genetics counseling, developmental pediatrics, a wide variety of areas, and it's a fabulous program. We're also really proud to be a partner with from the New Jersey Autism Center of Excellence, which is really driving a new perspective of autism and how to support autistic people.
I want to talk a little bit about all the work that we do to connect with our communities and to support our communities, our families here at the hospital and even beyond. So this is really anyone any family who's living with autism, even people with autism themselves. We really want to support their quality of life and a lot of the things that go on every day in the lives of people who are living with autism. One of the things we have here, and this is often, and this does not have to only be for families with autism, but we've created this thing called Color and Calm, because very often we hear families, and I'm a parent of a child with autism as well, many families living with autism, just the work and the efforts that are part of their lives are often just very busy and very stressful and overwhelming in many instances. And we look for ways to get help whether that be with schooling, with doctors, with insurance companies. It's just very overwhelming. So we've created this book called The Color and Calm that really is a coloring book for adults. It provides lots of insightful tips for you. It also provides some inspirational quotes and give you a chance to do something very relaxing, that you don't have to go out and do something major, but you could really spend some time and have something with no cost. Now, as I said, a lot of the stresses are often involved with regard to education. So what we've created at Children's is something called the IEP Reference Guide, and this is has a lot of it's a go-to book for special education. So as you can see on the right side of the table of contents, we talk about some of the common terminology that happens in the educational process, and what is an IEP, and what are the components, and how do I set that up, and all of the questions and answers. And even within this, we provide some other helpful IEP resources. So it's really a great go-to book that's available on our website online.
We also want to point out that our social workers and clinicians are available to families to help with any issues they might be having in schools, and they can help to link to other places that could provide some advocacy for dealing with school and related concerns.
So we have another book that kind of goes along with the previous workbook, and this is called the Annual Special Education Organizer. So this is a workbook that you could print out, again, free online. You can use this, and it really helps kind of document a lot of the things that we should be documenting on an ongoing basis, and often it's on a little post-it note or on a piece of paper that we can never find, right? So right now here we have something for you that you could kind of put together in a binder or staple, and really use this as your go-to workbook each year as you're working through your child's IEP process. We've also put together another kind of workbook, and this is, again, you could print each sheet individually, but many of us have those things. Oh man, this was a really great recreation provider, or oh, you know what, I wish I remembered that babysitter's name, or what was that event that I really liked last year, right? And so if we, instead of, again, those little post-it notes that we put all over the place, we created this way that you can put all of those things so you could remember them and be able to contact them, and it would be your own resource book. And as Jill mentioned just a few minutes ago, we have, we're doing a lot of work to help families through that transition, and individuals themselves getting through that transition into that adult world. So we created this workbook similar to the special education workbook that we've just talked about, and it helps with that transition process and who that team is and what the goals are. Each family has their individual each person and family has their individual goals through that transition process. And so this is a way to kind of work through that, talk through that, and really have a workbook and document so that you could all keep it together. Online, we know that lots of families have challenges in various everyday activities. So we put together several topics that we've identified or we've learned from our families that are really many of the challenges every day. So each of these topics that you see here, we've created a worksheet, like a tip sheet for, and a video that goes along with that. So every one of these, you can go online and get these specific tips and look at a video, a very short video, usually only a couple of minutes long, on various areas that might be challenging for you as a parent or caregiver of a child with autism.
And I also want to say, kind of going with Adrienne, what you were saying with Color and Calm and how busy everybody is and how things can be stressful, that these videos are really, I think the longest one is maybe 5 minutes. Most of them are shorter, so you don't have to invest a tremendous amount of time. It's just, we know, it's kind of like, okay, I only have a couple minutes. What can I learn really quickly? And the other thing that I think that we want to point out is that, we hear challenges, but we really try to take a strength-based approach at Children Specialized, and it's really important to note, in terms of the neurodiversity movement, and that people with autism or autistic people have many, many strengths, and a lot of the issues really are what can the environment do to support the person, as opposed to that the person has to be the one to do the changing and all this kind of thing. So we really want to support autistic people and their families in identifying strengths and building on that.
And just really quick on this real life tips with for kids with autism. On the base of strengths, we really want to support you and support the children and adolescents in life. And so we've provided within this program some tools, visual aids, things that you can actually use on a daily basis to support what you're doing. So those real life tips, for instance, is personal hygiene, and you'll see that's a picture of Jill right here, actually.
Many years ago.
And we, this is an example of one of the videos and the real life tips tools that we provide. So this is just kind of an example on personal hygiene, one of the things that we have we provide to help support these challenges. And in that same personal hygiene, this is on toileting. So this is a visual aid, and this is really to help support the education and the learning of how to be more independent in this toileting process. And it could be feeding, it could be toileting, it could be personal hygiene, but that's really what we're there to support the strength. So now we have Friends Like You, Friends Like Me. So this was this is really a great program that we developed, and this was several years ago. And I had the opportunity to present this within many school districts in the state of New Jersey. And it really is about seeing people's similarities rather than differences, and appreciating people's differences and their uniqueness. And it really is an important thing to instill in our young children's lives. So we created a coloring book. We have a book list. We have a Train the Trainer video and a program guide to help teachers and scout leaders or anybody who runs a program that involves children, all children. This is really about seeing people for who they are and letting them be who they are. So I really emphasize going on to Friends Like You, Friends Like Me. There's a video, there's coloring books, there's lots of projects and ideas that you could, teachers or parents can do with the children in a classroom or other. Really a great resource for everyone.
What I really like about Friends Like You, Friends Like Me is the whole philosophy behind it, which is that there's ways that we're all the same, and then there's ways that we're different, and you can embrace the differences. You could learn from people who are different from you. So it's not just the person, it's not just one direction that we learn and help and support each other.
Thank you. So this is a music video that we developed in part of our program that we have, and it was a lot of fun to create, and this is part of the song is called That's What Friends Do, and it's really about making friends and supporting what we just talked about with Friends Like You, Friends Like Me. So we have a music video online for Make Friends with Autism. It came out of the program that we originally started, was really how to educate and support people within the community to make friends with people with autism and to accept autism as autism really is about who a person is, and let's just kind of help understand that and include people who have autism in our lives every day.
The cool thing about Make Friends with Autism, it has lots of cool resources for businesses about what they can do to be more friendly and welcoming for people with autism, and when they do that, then everybody benefits. That these are things that anybody could benefit from, so it's really a win-win situation.
So this is that music video that I just noted. It's called That's What Friends Do. So you kind of can look it up. That on the right there, there's a New Jerseyan. His name is Dan Weiss, and his wife Mary Olive Smith. They put this video together for us. So look it up. It's really fun. We played at a lot of our events. It really is very uplifting. You can include that kind of video at a movie, at a meeting or community event. It really is very uplifting, and it really sends a message that if we just seek to find the common ties that bind us, then that's what we do. That's what friends do. That's how we can be together, that we just have to find our similarities and really just be together as we are.
Right, and build from that.
So we also we have coloring books online. This is an example of, on the left there's a coloring book, pages from the coloring book. On the right, is an activity sheet. So there's lots of activities within, on our website that you can go pull some of these things that really support a lot of these messages. Another aspect of what we do for community outreach, a lot of the work that we do is on safety. And it started out with just something we were doing to support families, but we really have come to find out a significant amount of safety issues that people live with every day. And we really wanted to try to identify those challenges that families live with autism, common things like sensory challenges or potential poison issues, fire safety, water safety, as Jill talked about earlier. So lots of these things are important. So we created this Autism Family Safety Handbook. It's free, it's online. You can look at one page, you can look at them all, but really a very, very helpful resource related to safety. We also, and there's many, when you go on our website, we have lots of things on safety, so we're highlighting a few of them here today. So you just saw the Family Safety Handbook. This one here is about 911, and we want 911 is obviously there to support us all when there's an emergency, but we have to remember that a person with autism may or may not understand what an emergency truly is. So we're providing this tool for parents or educators to support that learning process, and also to provide a tool for people with autism to practice, to understand, again, what the emergency is and what to say and what to do if they were to call 911. I will emphasize that there are many people who have autism who may not be able to call 911, but many can be taught, and many should be able to protect themselves and those around them. So that's what you see on the left. On the right, we've created a complementary piece for emergency dispatchers, so they understand what, if they receive a call, if the person may not understand the instructions, or may need the instructions provided a little more clearly, if they're repeating back what the dispatcher says. There may be a lot of things that may seem a little odd with the communication of the person on the other side. So it's meant to be to help educate an emergency dispatcher about what they may interact with if they have a person with autism on the other line. And that can be vary from person to person, but it gives them a little bit of education. Another resource we created these ID cards that that are able to be printed. Sometimes I printed them myself on business cards that you can get, in the dollar store, and you can either write them or type them or put them into your computer and create your own. There's many that are available online, including ours. And what you see on the left is like an emergency information sheet, because it's really important to put a lot of this information on in one place, so that we have it available. When crisis situations happen, when we really are in a significant emergent situation, we want to be able to reference this or be able to give it to someone who would be able to have the important information. I do want to emphasize that in New Jersey, there is something called Register Ready. That's for emergency preparedness, and I really would like to advocate for that. That really is to help people with disabilities, their parents, their caregivers, to put this information, safety information, into a statewide database so that emergency responders are prepared for emergencies, disasters, various things like COVID or the recent storm we had, that they're prepared with the things that they need to support our families and our community. And one way that we can also provide information is by contacting our dispatch centers. Now, every town, every municipality has a different way 911 works. So what you need to do is identify in your local town who receives that dispatch call. Sometimes it could be the police department, sometimes it could be the fire department, sometimes it's a county or an outside agency. But once you have that information, what I would do is we've created this document here to facilitate a conversation that you can have with that emergency responder, that dispatcher, to help them know what your child might do in emergency. Would they likely run away? Will they respond when they call? Maybe the child has a physical disability too. So that information really is important for emergency dispatchers and emergency responders to know. I really have to advocate also to have these discussions with your local emergency responders, and especially, for instance, with fire rescue, if you've made modifications to your home that, whether your child, the child has a tendency to wander or elope out of the house, or if you have potentially solar panels on your roof, lots of these things would inhibit fire rescue. So these are the types of things that you really should communicate with 911 dispatch centers as well as with your local emergency responders.
We're really trying to encourage people with autism or any other type of disability to have ongoing communication with their first responders in the town in which they live, so that they can kind of get to know each other in a non-emergent situation, share what works, what concerns they have, get some information about that might lead to prevention, so that it can really hope to reduce potential for injury.
So we've created what we've called social stories, but really, they're pictorial narratives or just books or sheets here. You can print these out. We'll talk about that because we're going to show a few of them, which are written in the context of the person with autism or the person themselves. So this is helping them understand safety situations like wearing their seatbelt, walking through town, so pedestrian safety. So this is written in the person's point of view and what they should do in the community, or wearing their seatbelt, or whatever that safety story is. So we have online several of these to help a person with autism learn for themselves and really empower them to be safe for themselves.
And, as you can see, we really feel so strongly that safety is fundamental. It's a fundamental right, and it's fundamental to a person's health. And so we're super excited because we recently received grant funding from the State Department of Human Services, focusing on inclusive, healthy communities. And with our grant, what we're looking at is how to live safely for people with disabilities and special health needs. And so really by partnering with self-advocates and various experts and community agencies, we're trying to build a safety coalition and focus in so many different areas about how we could really try to promote safety and promote access to resources that are truly accessible for people with disabilities, accessible and functional.
And I think this is one of our last social stories that we're going to share today, but this one is as common as using a public restroom, right? Sometimes we forget, and these are things that you could create on your own. We've created a template online that you can really take your own pictures and create these yourselves. Sometimes we forget. We talked about the transition area, and as we're transitioning into adulthood, what about teaching how to renew your prescriptions? Or what about things like taking, I guess that's Uber or Lyft, right? So these are things that we can teach and really support people with autism so that they can become more independent and safe. And soon, we're really excited about this, very soon, we will be releasing something called Healthier Me. So this is, it's going to be a mobile app, and online there are supportive web resources that are focused around being a healthier person. So this is a way that a person could open their app, and it'll be available on the iOS and Android and Apple products, and they'll be able to go in and look at daily activities, healthy eating, healthy being active every day, personal hygiene activities, eating, drinking, all of these things are really important to being a healthier person. So this app is really meant to help a person with autism, children, adolescents, adults, with or without disabilities, actually, just really being healthy, staying active and safe. And it's really, we're very excited and very soon, so please be on the lookout. We'll be releasing that soon. And online on our website will be the resources that go along with that app, so educational resources that parents could use, that teachers and educators and healthcare providers can use to really help people with autism, all people, to be healthier and safer.
Yeah, one of the things that I really like about this Healthier Me app is that it's fun and that it's also customizable in terms of, well, what are the things that I want to focus on and work on? What are the things that I would use as a reward or that is going to be motivating me to do this? So we're excited. Can you tell?
So I want to, we can't end today's presentation without really saying that a lot of this has, all of it, that we have talked about today has been supported by the Coles Cares program. The work that I do out in the community outreach, the developmental screening clinics that we have done for many years, all of this has been done through the generosity of Coles Cares, and Children's Specialized Hospital is really very grateful for the support, the ongoing support that Coles has given us to do this work.
So we really encourage you, for more information, to call us, to go to our website. This is the contact information for Adrienne and for me. One of the things, if you could explore around the website, we have so many webinars and resources on a wide variety of topics that are relevant for people with autism and their families. For example, I know we're asked a lot of times for help about, how do I explain puberty? What about sexual health? What about applying for disability? What about sleep problems? What about handling issues in school? What about siblings? That's so funny. We said sibling at the same time. Anyway, so really, if a topic is of interest, we might have already done a webinar about it, and we also have plenty of resources. And again, and we're happy that many of the resources are available in Spanish as well as in English.
So if you look at the website on the top, the RWJBH.org Children's Specialized Hospital. After that, if you are interested in some of those webinars and looking at what any of those videos, just add to the end of that patients, patients -visitors/webinars. So that website, and then add patients-visitors/webinars, and you'll be able to find that list of webinars. Anytime, you feel free to email Jill or myself. The email addresses are here. We can help you find any of the things that we were talking about today and more. If you have questions about autism program, Children's Specialized Hospital, please feel free to reach out to us. We're really very happy, always happy to share what we have.
Thank you so much.
Support public libraries. Like, share, and subscribe for more great videos.